Just a minute more. Okay. All right. Okay, Linda.
Are we ready?
Yes, we are.
All right. Yes. Good evening, everyone. Happy holidays. It is a great opportunity again to present another community conversation. ANWEP USA, through project leaders across the state of Texas, has created a culturally safe space for African immigrants, Blacks, and communities of color to safely talk about and discuss their fears regarding the COVID-19 vaccinations. And so this platform is created to give us a safe space to talk about, discuss, and help us understand and be educated throughout our communities on the benefits of the vaccine, and to share the information that we get consistently that the vaccines are safe. This presentation this evening is going to be very informative. We have a couple of special guests, but before I turn it over to Ogechi to introduce our guest speakers, first of all, just a few minor webinar conversations. In other words, mute when individuals are talking, please, and then be mindful of your responses and giving our special guests an opportunity to get through this presentation, because we try to keep the presentations within an hour. And so without further ado, let me introduce Ogechi, which is our project director for the Texas State COVID-19 project. Okay, Ogechi, ready to introduce our guest.
Thank you so much, Linda, for that very warm introduction. I want to welcome everyone to today's event. This is one of the many series of community conversations that we have around COVID-19 vaccines. One of the many tragedies of COVID-19 pandemic has been its disproportionate effect on minority and immigrant communities. ANWEP is working in partnership with the CDC and the Texas Department of Health and Human Services to ensure greater access and knowledge of COVID-19 vaccines through education and outreach to populations disproportionately affected by COVID-19, with the goal of increasing the number of people fully vaccinated for COVID-19 in Texas. Today, we have with us Dr. Hackney, and I will read a little bit about his bio and his work. I will just keep it I'll summarize it because his resume is packed, his bio is packed, and I wouldn't want to take up a lot of our time reading it because we're about to meet him and hear from him firsthand. So who is Dr. Richard Hackney? Dr. Richard Hackney holds faith, character, and dedication to his life's purposes as the foundation for success. This characterizes his life and has led to his many accomplishments. Born and raised in Cherokee County as one of the youngest of 11 children, the Hackney household knew that faith in God brought about strong character, and strong character propelled one to work in excellence. It was this mantra that led Dr. Hackney to receive his undergraduate degree from Texas Southern University, PharmD degree in clinical pharmacy from the University of Tennessee College of Pharmacy, and is a retired inactive registered pharmacist by the state of Texas. His more than 50-year career in pharmacy includes 17 years in oncology pharmaceutical sales as regional, territory, and district manager with Bristol Myers Squibb Oncology, 9 years in pharmaceutical sales training, consultation, and recruitment with the Hackney Group, 5 years as an assistant professor of clinical pharmacy, 4 years in hospital pharmacy management, 2 years of university administration as interim vice president of institutional advancement and development at Texas Southern University, 2 years as HUD-HBCU program manager at Texas College, and in addition, many years of local, state, national, and international speaking engagements. He has designed and lectured in pharmacy technician programs at Progressive Learning Center and Trinity Valley Community College, and served as a guest lecturer in medication aid programs at both sites. Dr. Hackney is presently involved as a community organizer in rural East Texas, pertaining to issues of agriculture, and founder of the Rural Northeast Texas Healthcare Task Force, focusing on equity and disparity in healthcare and organizing COVID-19 vaccination sites in communities of color in Northeast Texas. He's also a team member of the Marvelous Monday radio blog talk show. Dr. Hackney is the proud husband of his wife, Teresa, and they are celebrating 56 years of marriage. He is also the father of 2 daughters, the grandfather of 8 grandchildren, and great-grandfather to 1 great-grandson. Wow. And this is just a summary of Dr. Hackney's bio. And now we want to welcome our speaker, Dr. Hackney.
All right. Well, Dr. Hackney and I were just on the phone. He kicked off because of the rural broadband issue that we're experiencing in rural Texas and other rural places around the nation. So he's going to attempt to actually call in. So if we could, I'll get you, be prepared for him when he calls in to let him in at this particular point. But thank you very much for, bringing Dr. Hackney here to be a part of what you're doing, and then also what we're doing from a Church Hub perspective here in the Northeast Texas area. And as you said about Dr. Hackney, and I'm going to fill in until he comes on because there are people who are waiting. Dr. Hackney and I met through a phone call where we were referred as a church location for a COVID-19 vaccination clinic. And he and I spoke on the phone as it relates to that, because he and I both knew that there was an issue of the vaccination rates in the rural, the minority, African-American, Asian-American, Hispanic, the African descent communities. We knew that there was a major issue in our market area, and when it came to vaccinations. So from there, he and I have developed it's a short relationship, but it's just as if we've been working for many years on this particular project. And he and I will talk more about specifically the much broader issue that we have. COVID just is one of the, I would say, one of the needle points of sewing together entire fabric to deal with health disparities in rural, minority, poor areas in our nation, and that we as a community must be willing to engage in that process to fix this issue. And we have to be at the table when it comes to fixing these issues. And you'll hear us talk about even more about the issue of, is the system really broken here in America when it comes to healthcare? It's amazing that we in America have some of the best healthcare for those who can afford it. And that is a loaded statement, that we have individuals who were shielded from, COVID because they were in a 4-bedroom house or a 5-bedroom house, and one person was infected with the virus. They could isolate. But what happens when you're in a 2-bedroom apartment and you only have one bathroom? It's very difficult to isolate in those particular situations. And we'll dig into that on figuring out specifically how do you solve this particular issue of COVID. It could be the flu. It could be almost any of these arrows, any of these issues that from a medical standpoint that are spread through the air. Dr. Hackney, he has a passion for this. He created Northeast Texas. There's a healthcare coalition that he created and the network that he created, and with pastors and with leaders and that really want to deal with the dissemination of information throughout our communities, because it's important that we as a community are involved in the process. I know some segments of the religious community say, well, hey, you don't need a vaccination, trust God, he'll do it. However, the way I look at it is that from a person who is responsible for the souls of people is that I want to make sure that you live comfortably while you're here on earth. And God has given us in a quick period of time a solution to one of our problems. And I think that's important for those people who are on the other end of this thing would say, well, hey, you don't need to be vaccinated. I think God has given us this opportunity to experience this. And he brought people together from all segments of the community. Just imagine, and Dr. Hackney will share about this, the number of pharmaceutical companies who came together to work together on one solution to solve a world problem. And just imagine if we could do that for other issues. When it comes to COVID, is it really impacting our community a lot? Yeah, it is. But it's going to take us, as I said earlier, working together to make this work. And, Dr. Hackney is continuously sending us information every day, 2 or 3 snippets of information that he's collected from doctors as it relates to the people who are impacted. Even today, he sends a message to us that's in the USA Today, and the message is the uncounted people of color are dying at a much higher rate than with COVID than what data shows or data suggests. How does that happen? And that's a USA Today article that was shared through Apple News. One thing that is happening is that, someone dies at home, and what happens? The person just dies. No one says specifically why, or the community in which they die in. There's only 1,500 people in that community, so there's no autopsy that's done. There's no determination of specifically what the person died from. They just died, which means there's an undercount of people in rural America. And if you undercount, you really don't know specifically the impact of a particular disease in a particular market area. And it's just like insurance, which is one of my backgrounds, it's just like everybody needs insurance, but guess what? If you don't count the people to know specifically what that amount of need is in a particular market area, you're undercounted. The census is an indication of people being undercounted also. So when Doc comes in, I'm filling in for Doc. Hopefully he can get in with us so we can talk about this. But, it's important for us to advocate for individuals who really need the opportunity to take the COVID vaccination. There are places where I've been this year. I've been to Africa twice. I've been to Mexico once. I've been to India. And there are some folks who are in these market areas. I guarantee you, if they had an opportunity to be vaccinated, they'll take it. We who are here in America, sometimes because of all the choices that we have, we don't take advantage of it. We assume that we listen to the rhetoric that is on social media from somebody who's not an expert. And so I just want to encourage people that if you want to know the truth about this particular virus, you need to actually ask somebody who is certified to answer the questions as it relates to that. And I think that's why we brought Dr. Hackney on as a pharmacist, because he understands specifically what happened. And also one of our relatives was on the project team to actually develop the vaccination. So, of course, family members calling her and saying, hey, is this thing real first, or is it just some hoax? Second, did they really develop this solution that quick? And what did we find out? Yes, from a trusted person that we know, guess what? It's real. Two, guess what? We have a solution to this particular problem. So just want to encourage people to, especially those of us who have influence. On Sunday morning, on Wednesday, on Tuesday, we have a lot of influence in this world over people and what they do. Really give people the facts. And if you don't believe that, that the virus is real, have a conversation with somebody who knows that it's real, or walk through the corridors of a hospital or a morgue, and you'll see that, hey, this is a real national, international crisis in our nation, and there are people who have died from it. I feel, this is my personal opinion, that they died because they refused to get vaccinated. Mm-hmm. And we'll hear all the other stuff on the back end of this on, well, this person had this problem, this person had that problem. But for the greater good of society, I think that this was a great thing for us to have. We saw where the world could come and work together and make some things happen for the best of the group. So like we're delayed with Dr. Hackney, so I'm gonna move into my next question that I was gonna ask him. I was gonna ask him questions, but since we have people on and we down to about 34 more minutes, hopefully I can talk for 30 minutes for you, and hopefully he can come on. But when it comes to the Church Hub, this concept that Dr. Hackney developed was, let's create a place where people can come and get information. It's much bigger than COVID because there's a whole lot of misinformation in our community. Right. So, and when I say our community, I mean the rural, the African-American, the Hispanic, the Asian American, the anybody of color type of situation where whether it's intentional and unintentional, I don't have time to unpack that on this call. But there are ways where people are not receiving the information. It's bank accounts. People not receiving information. You talk about healthcare. People not receiving the information. There's all kinds of not enough information to make a healthy decision for the family. So what Dr. Hackney developed is this Church Hub concept, where the goal is to have locations strategically placed throughout Northeast Texas, where individuals can come and get accurate scientific information that has been validated. And also the second component of this is to have a 800 or 900 or some number where you can call and get the correct information. And so the goal, that's what our goal is for this. They're strategically placed throughout Northeast Texas, from Texarkana all the way down to Beaumont. And what we want to do as a group of individuals, religious leaders per se, is make sure our members and when I say members, I'm not talking about the geographical location of the church. I'm talking about the holistic member conversation of people who are in the neighborhood in which you serve as a pastor or a religious leader, that those people have access to accurate information. Hearsay is killing people. We have to have accurate information, and our goal is, let's deal with getting some accurate information out there in the hands of those people who trust pastors and leaders. And this is how I think we're going to be able to push the objective forward, is let's get some accurate information out to the people. Let's put some sessions together where they can ask the expert. The third component of this is, one is, let's set these hubs up. Two, let's make sure we have the experts connected to the hubs. Three, let's have some help fairs where people can come in, and sometimes people don't know the right question to ask. For instance, the doctor says you have high blood pressure. All right. The doctor wants you to get in, get out because of the way their system is set up. That's just the system. However, what if you could ask a question on what can I do to lower my blood pressure? Some people don't know they can ask that question. Some people don't know they've changed their eating habits. So question and answer during these health fairs. The fourth component is, let's make sure we have healthcare facilities that are in, I would say, walking distance of individuals. What we've discovered is in some market areas that you're in a rural area, the hospital is an hour and 15 minutes away. You may have a doctor that's in that town, but you may not. The doctor may be in the same distance, an hour and something away. Here's the problem. You don't have transportation. You may have a car. It can get you to the grocery store that's 5 miles away, but you can't put this car on the road to take you to a location where you can be seen, which in turn, so now you have these barriers. You have the barrier of transportation. You have the barrier of illiteracy. I don't understand what he's saying. I just don't understand the doctor talk. So now you have these two barriers, and these two barriers, what is happening is creating a situation where people can what? They cannot what? They can't function in the system, which means that if they can't function in the system can't help them because they don't know how to access it. And that's what the goal is with Dr. Hackney and the team, is that we want to go ahead and put this system together where we can break it down to how grandmother can understand it. And since she's the influencer in the family, she can explain it to everybody else. And we want to use the church as a location, since it's a trusted place in most communities. The sixth component is this broadband issue. We experienced it tonight. Thank God for us experiencing it tonight. There is an issue with broadband. Access to the internet. Remember, during COVID, guess what everybody say? Go to your cell phone, go to your computer, and talk to your doctor over the system. Wait a minute, that's great, but my internet only works for 3 hours a day. I don't have the capacity to talk in video at the exact same time. So how's he going to diagnose this particular scar that I have on my hand, or this rash that I have on my hand, when he's only seen it in a grainy type of way? So that's another issue that Doc and I, spoke about that. And I think that is important for us to be able to share that. This is Doc on the line. Hey, Doc. Okay. You won't be able to get on. Okay. So we'll try to reschedule, but I'm going to do a summary for another about 10 minutes. And then from that point, maybe we can reschedule sometime and we can get in a better location to get it done for us. But thank you very much. Okay. Thank you, Doc. All right. Thanks. Bye. Bye. All right. So Doc is not going to be on. So it looks like you're going to have to listen to me for a few minutes. Thank God.
It's okay. Yes, we will reschedule. And thank you so much, Pastor Riley, for filling in for him and for articulating very well some of the issues on ground, issues that face our target population in East Texas, which is also the same across so many of the communities where our African Americans or Black communities reside. You mentioned transportation. We've seen that a lot with our outreach, the vaccine, COVID-19 vaccine outreach and education. We have the elderly or the senior citizen populations that are
You muted yourself.
Oh, yeah. Sorry. We have the senior citizen populations that have been asking about mobile kind of drive-through vaccine clinics. Some of them have issues with transportation or even walking, and they were, they've been asking us about, areas where they can just go and do their drive-through vaccination. You mentioned language barriers, cultural barriers, illiteracy. Some of our people are not able to understand the content of some of this messaging because it's not tailored to us. It's not culturally or linguistically appropriate for us, correct? So we have, we have communications that's designed and built around people who understand or speak a certain way, or, English in a certain way. And some of us, we're struggling to grasp what the meaning of things are. So we need to factor in creating messaging that is tailored for people, our target population, to understand it, right? And also, reaching out to the areas where our people get information, right? So now we have this issue with access to the internet. Most of our target population may not get their news from social media, TikTok, Facebook, or whatever. How can we get this message to them so that they get it? So now we have to think about places where they go to get information, and church, places of worship come up top on the list, because our people, most of us are very faith, oriented. We belong to churches, we belong to organizations. So how do we locate those areas that our people are most likely to get their news and information, and make sure that we create targeted messaging that will be the same across the board, so that we're all speaking in the same language, and breaking things down, information down the way that our people can understand it, the way that are culturally sensitive to our target population. So those are the two things that I think that we ought to work on. ANWEP actually started to do this with our immigrants in mind. So we designed our communications in about 5 languages that are spoken by our target population, some of the immigrant communities, like Swahili, Yoruba, Hausa, and all that. And what we've seen with breaking down our communication in these different languages is that people are beginning to trust us. We're beginning to build trust, because a lot of the factors that are making our people hesitant from receiving the vaccines is lack of trust in the government due to past history, right? So, but with us breaking down that information in the language and content that is culturally appropriate, we're beginning to see people accepting the vaccines. They are now trusting us and listening to us with our outreach and education efforts. And some of them are actually getting vaccinated as a result of our outreach and education. So like Pastor Riley said, we may have to have things on ground like health fairs, where we can connect with these people. And I look forward to partnering with Dr. Hackney on the health fairs in February in East Texas. I know that ANWEP would love to be a part of it, to engage firsthand with our target population, to hear their concerns, to see where we can help and what we can do to make such, some of these barriers kind of to reduce the frustrations that they face with some of these barriers to accessing health information or health care. So I know that, Linda, you made some suggestions about the church creating like safe spaces to discuss healthcare issues. And I'm wondering if Pastor Hackney has anything to add to that.
And I do, that's part of one of the objectives that we have, is to make sure we establish the health ministry, which from a biblical perspective is called the HELPS, H-E-L-P ministry. It's a spiritual gift that people have to assist and to help people, and especially with nurses, doctors, those people who are in the healthcare arena. There is a role for them to play in the life of the church. And it's just that we have to educate the pastors on specifically how to engage those individuals in the life of the church. And I think that's important if we're going to say, and I say save from a physical perspective, this next generation, because it's much bigger than just the vaccine, the vaccination. It's also moving up to that point, what you consume, what you use as the fuel for your body.
Nutrition.
It's also an issue that we saw through this COVID pandemic was, one, if you're not healthy, you're more likely to die from this, but you're unhealthy because you don't have access to good food. And I'm not saying grandma's pig feet aren't good. I'm not saying the neck bones are good. However, there's some other options that you can use that will actually help you have a healthier lifestyle, which in turn will give your body the ability to fight off these new viruses that are coming, more so than the issue when you have, you have to fight it off with drugs and things of that nature. And that's what I think happened in some of the places and some of the less developed parts of the world, where COVID existed there, but now that they're testing people there, it seems like the people have survived this wave. And I think it's because the food that they consumed, and then it moved through so quick. Now there's some immunity that has taken place. And we as human beings have a unique gift that God has given us. We can adapt to almost anything that tries to tear this body down or move this body from being in existence. So I think that's part of the conversation that we have to have inside of the church that will actually help people move to the point where, one, you get to consume some good food. Two, you have to have these ministries that are in place that help people that will be great. I can remember my aunt, who is in ministry in Northeast Louisiana, and her first message was on hand washing. She gave a sermon on hand washing, and it was very interesting. This is before the pandemic, and that message is a message that needs to be heard today, because people never even thought, well, I can pass this on by not washing my hand or not wearing a mask, or some simple things that could keep you alive. And not only you, but those individuals that may not be as healthy that's in your circle of influence, you can keep them alive and become your brother's keeper or your sister's keeper, because you care more so about the whole holistic approach of humanity, more so than about it's me, myself, and I. But I think that's part of, and that's a great suggestion, Linda, of having these discussions inside of the religious sections of society, and having that discussion about how you put these ministries in place, effectively put those in place. And then let's just not talk about the funding on those, because there's funding out there for healthcare education. If you have your right system in place, you have your 501c3 and your corporation set up and your board set up, there's also some funding out there that will help make that happen.
Yes, that's awesome. Go ahead, Linda.
Yeah, I just wanted to open up any questions.
And let me try to bring them in. I'm gonna see if I can bring
want to get some
in.
feedback from them. And so as you come in, please unmute your mic and then ask your questions directly. I think this is a pretty good opportunity, a really good closet conversation regarding the outreach, in particular is the church as really one of the major beacons in our nation, actually, definitely. And I noticed too, in our communities, it's a church on every corner.
It is.
It really is. Even where I go to church in the South Dallas area, I mean, it's a church on every corner. And so, Pastor Riley, yes, you as a bishop, over several churches, it's a great opportunity for you and Dr. Hackney to, collaborate and commence these pastors, with community churches to really, let's collaboratively work together. So this is great. So any other questions, because this is good. So I'm going to hold my mic.
It is really great. And what ANWEP has started to do is to create this community conversation, which allows us to bring in people like Pastor Riley, people like Dr. Hackney, to share some of this, what we're, talking about today, coming from, say, the expertise of the medical practitioners. When we started this community conversation, the first person that we had was Dr. Kunle Tometi, who is a PharmD, just like Dr. Hackney, and he took us through the makeup of the vaccines, how it was developed, because there's a lot of hesitancy around mistrust of the contents of the components in the vaccines. People were not satisfied that the vaccines were effective because of the speed at which it was developed. So Dr. Kunle Tometi was able to explain to us from a professional standpoint, somebody who is an expert in that area, walk us through the content and the development and everything. And it was an eye-opener, even to some of us, who have a little bit of training or idea as to how this thing was done. So, and that is us having these conversations at a much higher level, but we want to create opportunities and partnerships in churches, mosques, and where our people get their information. Every church has several professional people as members. You have doctors that are members of a church. You have nurses. We need to try to have these people share their talent with others. If it's true, maybe once in a month, every Sunday, we get a professional to talk about, say, nutrition. Some of the things that we can do to keep our body and our immune system strong, so that even when we are hit with an infection as dangerous as COVID, it doesn't take us down, and he also mentioned, I know Dr. Riley mentioned something about pre-existing conditions like diabetes and high blood pressure, some of these things that make us more vulnerable too for suffering severe symptoms when we're exposed to COVID. So it's just a matter of us connecting with faith leaders, community leaders, people who are in the healthcare industry who don't mind volunteering their time to help us craft messaging that we can share with our people. Because, in my culture, they say information is power, right? So sometimes all we need, you don't need when somebody hands you a large sum of money to get the help you need. Sometimes all you need is information, what to do, where to go to when you're faced with certain issues or certain, problems. So I have Catherine Robinson here. Catherine, do you want to add to the conversation? You can unmute yourself. We also have Ngozi Maduebuna, who is also a member of ANWEP, and she's a nurse practitioner. We have Stephanie Richard Obire. Please unmute yourself and add to the conversation.
Good evening, everybody.
Good evening.
Hi, this is Ngozi. Thank you so much. Thank you so much, Bishop Riley.
You're welcome.
Yes, that was a good teaching right there. And in regards to what you said about the transportation issue, I think a couple of weeks ago in my church, I spoke to some African sisters I met, asking them if they have gotten their COVID vaccine. And one of them did, I think she got the first dose, did not get the second dose due to transportation.
Mm-hmm.
So I asked her if she do have insurance, and yes, she have Medicaid insurance.
Mm-hmm.
So I told her that there's a number she can call, and they will schedule a transportation for her. And guess what? She did that. When I saw her the next Sunday, she got her COVID vaccine.
Mm-hmm.
So she was able to tell the rest of the families that didn't know about the transportation included in their insurance. So I believe once we keep telling people, some people don't know, especially the Africans,
Mm-hmm.
they don't know that Medicaid cheap can cover their transportation to their doctor's office. So that's a good point right there. And I
So
told them,
much, Ngozi. That is a great, 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 great input, because, you know, some of us don't know what is available to us. And this is one of the conversations that we were having with a doctor at the event that we went to, the African Trade and Expo event. And
Mm-hmm.
he was actually saying things about how some of us in the Black communities don't know what we have available, what is, you know, what is accessible to, not accessible, but what is available, you know, things that we can do to help ourselves. The information is out there, but we just don't have it. We don't know it. So this is a great example of that. Somebody has Medicaid, has the card in their hands, but did not know that there is a number to call for transportation. And because of that, that barrier existed, you know, like having not to have access to the vaccines because of transportation issue, when all she needed was the information. Thank you, Ngozi, for sharing that. That is a very great input. Catherine, do you have anything to add to the conversation? We have about 8 minutes left. I see that you've unmuted your mic. Can you go ahead and talk? Let us add to the conversation. All right, while we're waiting for Ms. Robinson, Stephanie, do you have something to add?
No, it's like I'll just echo what Ngozi said. It was a great conversation. Thank you, Bishop Riley. I've just been with ANWEP for about a month now, so I'm getting to learn things, and I've attended a couple of the outreach events and health fairs. So I just want to say, you know, Mrs. Ogechi, you're doing a great work, and everyone at ANWEP. And I'm just happy to be a part of this, and you know, to learn and help out in the community, and you know, reach people like me, and you know, give people the information they need. Like you said, information is power. Information is key. I mean, if we can't do what we don't know, right, or you know what we can't see. So just thank you for all that you're doing, and I'm glad to be a part of it.
Thank you, Stephanie, for that input. Catherine? She's probably having connectivity issues as well, because I see her unmute her mic, but then I can't hear her. Catherine, can you hear us?
She can give us a thumbs up if she can hear us.
Yes. If you can hear us, put a thumbs up in the chat.
She can hear, okay. And she can also in the chat, she can
Okay,
do
so
a
she
question
can
and
hear
answer
us.
in the chat or the Q&A.
Yes. All
Anything?
right, you can also add your comments on the chat. Or if you have questions, you can go ahead and add to the chat. I believe that's all we have for today. Great discussion. Thank you, Bishop Riley, for standing in for your friend.
Yes, you're welcome.
Hopefully, we can get him to attend next time. If there's a way we can support his internet connectivity, let us know.
They're in a rural area. I mean, when I say a rural area, I think there's maybe 900 people in the town. You know, we've had calls before like this where it worked well. He does calls like this with people and it works well. But when a storm comes through, which we're experiencing in Northeast Texas right now, it knocks it out. And if we think about that from this perspective, just imagine if there's a medical emergency. And a storm comes through. And we know we've had tornadoes in the last couple of weeks, last couple of months. We've had this ice issue that has happened. All of those things, I think, from a broader perspective. And that's what I want to encourage our group is that there's COVID is one thing that we're dealing with, but there's multiple things that need to be dealt with. And I thank God that you all have created the organization to start teeing some of these things up, where we're able to not only just focus on COVID, but there's some other issues. Broadband is another issue that we need to deal with, especially since we're going to the metaverse, we're going to virtual everything. We have to have access to the internet. You know, we're talking about Web 3.0. There's some people on Web 0.0. And I think that's going to be important for us to work through that. So thank you very much for giving me an opportunity. I'll work with Doc on another time where he can be on, and then we'll just work from there. But thank you very much for the opportunity to share with you what he and I and the team are working on when it comes to the Northeast Texas Healthcare Task Force.
Thank you so much, Bishop Riley. You are a great support, a great resource to our organization. Since we brought you into the project, you've really helped us make some critical connections that is helping us to fulfill our mission and our goal for this project. So thank you so much for being a part of our efforts to educate our people about not only, like you said, COVID-19, but other health issues that confront us as a community. Thank you. Linda, do you want to take?
Hold on, Ms. Oga, I raised my hand up. Just a minute.
Okay,
yeah. I just want to suggest something in case of something like this that happened. If the person is having poor connection, the person can just call in via the phone, and you know, we just hear the person talking through the phone.
Yes, that's a good suggestion.
Yes.
Yes, that's a good suggestion. And typically the Zoom meetings have a bunch of numbers, calling numbers in the invite, you know, that they can use to call in. Yes, that one escaped me as we were trying to bring him on. You know, he could have just called in, but that's a great input, Ngo. Thank you.
You're welcome.
Yeah. So hopefully we will get him next time. And for next month, I'm also hoping to get the doctor that we met at the event, Bishop Riley, to talk about the housing barriers, you know. Yeah, we will keep this conversation going. It's very much needed, and hopefully we can expand to having in-person community conversations as well for those people who are challenged in some way, that are not savvy enough to do Zoom, or they don't have a computer. We can plan in-person community conversations like this, just like we plan the health fairs, and have a panel discussions, put together a bunch of experts so we can hear directly from them, as they break down some of these scientific terms to the, the way we as lay people can understand. Mm-hmm. Yeah. All right. Thank you, everyone. It's a pleasure to have everyone. And we had definitely a nice conversation today, and a lot of golden nuggets. And, we always learn, there's always an opportunity to learn new things, and this is a great learning opportunity. So thank you, everyone, for your time, for your contributions.
Thank you.
Thank you.
And Happy New Year if we don't get to see you again before the new year.